At Restore 3D, we believe that every patient deserves personalized care. As a world leader in patient-specific 3D printed musculoskeletal implants everywhere in the human body, we leverage cutting-edge technology to transform patient outcomes. Our proprietary expertise in 3D printing, osseo-integrated materials, AI-based planning and design automation tools, and digital health solutions ensures seamless data-backed care. Join us in reimagining the musculoskeletal reconstructive landscape. Learn more at restore3d.com. That's Restore3D, where every innovation meets personalization.
From medical media, this is The Ortho Show.
Hello, world. Dr. Scott Sigman, your favorite opioid-sparing orthopedic surgeon, here for a very special episode of the Ortho Show podcast. We are going to talk about one of the hottest topics in orthopedics, and that is personalized orthopedic implants. We are sponsored today by Restore 3D. We have three outstanding guests that are going to join us. We've got some science and we've got some clinical. We got really great people here. So Ken Gall, who's the Chief Commercial Officer of Restore 3D, is the man behind the science. He's also a professor of mechanical engineering at Duke University, in addition to his role at Restore 3D. We have Greg Martin, who is a hip and knee joint replacement specialist in private practice in Boynton Beach, Florida, is literally one of the country's leading experts on personalized joint replacements for hip and knee replacement. James Toussaint, who is an orthopedic surgeon, specializes in foot and ankle from Gainesville, Florida, is also one of the leading authorities on customized personalized implants for ankle replacement as well as foot surgery. So Ken, let's get it going here, brother. We're really so happy to have you guys, I think, on really what is a great topic. It is super exciting times for technology and advancement in all types of joint replacement happening at this point, right? I've been doing this for 27 years. And with whether it's robots or whether it's navigation or personalized instruments, and really now also personalized implants, this is a great time to be a doctor and a patient. So let's get started. Remember, my mother Judy's listening, so we got to talk in a way that she can understand this. But what does it mean to have a personalized implant?
Thanks, Dr. Sigman. For me and for Restore 3D, a personalized implant really means that we take a CT or some type of image of your joint. We take this three-dimensional image and then we recreate either the anatomy that you had or the anatomy we want you to have with a new implant.
Fantastic. So listen, I've got the worst feet in the world, James. Okay, I'm going to tell you that right up front. I got bunions that do not stop. And I can't wear 95% of the shoes on the planet because they all use the same last, right? Which is the mold in which the shoe is made. It makes so much sense. Why can't I have a shoe made for my foot rather than my foot going into a shoe that's not made for me? So the concept of personalized implants is very attractive. But, I think that one of the major issues has been in the past is the manufacturing process, the ability to scale something like this. So tell us what Restore 3D does to simplify the manufacturing process so that we can actually give you your own customized implant.
Sure. So there's two aspects that really help you scale this. And I would completely agree. It's about scaling this. It's a concept that makes sense. It's going to make a clinical difference. There's data to prove that makes a clinical difference. But the two technologies you need to scale it, one is called digital production. And that means that we can automatically take a CT scan, which is some scan of your body, segment it, which pull out all the bones you want automatically. Then that second part after we've done that is we can automatically design an implant. So we can take those inputs, the inputs of a surgeon or the past history of a surgeon, and design the implant. That process can happen very quickly. So we're talking 10 to 15 minutes. That's part one. Part two is you have to be able to then actually make the implant. So that at that point, you only have a virtual implant. And what we found is over the last 10 years is that 3D printing is the way you can digitally produce that. And so you can take that image, that recreation of the joint from the CT scan, from the digital file, and automatically make it with 3D printing of metals.
All right, so technology is king, right? So we can take these data points from an X-ray, right? We used to just have X-rays. Now we got CT scans. It's amazing what you can see. You can take that data, put it into a computer. And now let's talk about 3D printing, because, we hear this all the time. And 3D printing, I'm like, what does that mean? I got a printer upstairs. I hit the button, it goes over, and a piece of paper comes out. How do you possibly 3D print a chrome cobalt or a steel implant and make it into a knee replacement?
Well, it's actually not as far off as your printer as you would think. So if you have a printer, if you remember having a toner cartridge, it has a bunch of powder in it. And then if you had, remember a laser printer, it spreads the toner, and then that laser comes in and actually melts the toner onto that one sheet of paper. And then you're done. With a 3D printer, you actually have a metal powder. So you have a metal powder and a more high powered laser. So this laser is so high powered, it would normally explode the titanium, but it's all contained within a vacuum. And so this laser comes in, it hits the titanium or the cobalt chrome, melts it in one layer, and then the whole process moves down. And you could think of it like a second sheet of paper comes on and gets a place there. And then we repeat that process layer by layer by layer until the whole 3D part is built.
Well, everybody that knows me knows that I am a huge fan of lasers. So it's amazing where there's so many applications of laser in the world at this point. And so how long does it take? Let's say, so for our listeners, let's say the femur, the part that goes on the end of the femur bone. How long does it take to 3D print that implant for that patient?
Well, one thing I'll start by saying is about 5 years ago, that took about a week probably to print a set of those implants or a couple of those implants. Now you can print about 20 of them overnight in about 12 hours.
Which is absolutely phenomenal. Now, I know that Restore 3D has just recently purchased Conformis, so they're part of the Restore 3D family. Can you just give us a quick description as to what you're doing with Restore 3D that was different than what Conformis was doing?
Sure. So Conformis, as I mentioned, the two technology bases, they were very, very good at digital design. They had a great hip and knee team. They had a great manufacturing facility for all of the secondary finishing and all of the patient-specific jigs. What they did not have was the ability to 3D print their implants. So their total knee, their total hips were not 3D printed. The biggest change we made is we are now 3D printing those, which lowers the cost.
Which is probably one of the biggest issues, right? Otherwise, who wouldn't want a personalized implant? But previously it was very expensive and therefore more expensive than a standard, off the shelf. So again, for our listeners, I want to be clear. You go into the doctor's office, they do a CT scan of your knee. That CT gets sent to Restore 3D. You take that information, you take out your 3D printer, and you're making an implant for Judy Sigman that matches her knee exactly and will not fit any other person on the planet.
Yeah, that is correct.
How cool is that? All right, let's do some clinical stuff here, right? Let's jump on in. Let's find out. We're moving off from the geeky professor. That was fantastic. We really appreciate that, Ken. Let's move over to the clinical side here. Greg, so, obviously you've been doing this for over 10 years at this point. You were absolutely one of the key opinion leaders, one of the thought leaders in the process and concept of a personalized implant for total joint replacement. You've probably done more than just about anybody. So tell us, why were you so enamored with the concept of personalizing a knee implant to a patient?
Yeah, thanks, Scott. It's interesting. I was about 5 years into practice when I started to do and got exposed to anterior approach hip surgery. And what I realized was these patients were coming in at 2 weeks and they were hugging me and thanking me and they were out of pain at 2 weeks post-op. And I started to really almost like dislike my knee patients because I used to tell them they were going to hate me for about 3 months before they started to like me. So I really felt I was at this turning point at only 5 years into my career where I was like either just going to almost do all hips or I had to find a better way. And I went back to my fellowship years when actually Conformis was kind of born out of Brigham and Women's Hospital. And it was just everything, how some things just come together and the timing came together. And Tom Minus, who was one of my mentors, was in the office for like he was in town in Florida. And we started talking about it and I got re-exposed to it. And the concept just made sense to me. Like I just, some things just make sense. And if you make an implant to fit a patient rather than open up a patient, try and fit an implant, it just made sense to me that these patients would do better. So early on, it was just a theory I had, but it just made sense and I stuck with it. And then as time went on, I just became a big believer. And then when we started to do it on the hip side, it also made sense because we see, hip patients generally are very happy, but if you make their leg a little bit too long or you push their hip out a little bit too far, you can still end up with an unhappy hip patient. So I just like this technology. These are great surgeries, hip and knee. We all get good results for most of our patients. But what is really most compelling for me is that this is a technology that leaves no patient behind. Nobody wants to be an outlier. A patient doesn't want to be an outlier. Doctors don't want outliers. So this is a way that we can plan and deliver a great outcome for every patient.
Yeah, I mean, I think it's really interesting. Again, for our listeners, we have both orthopedic surgeons, but we also have a lot of patients that listen to us as well. And, 20% of patients that undergo a knee replacement, are not happy. That's the literature. That's the patient-reported outcomes. I always joke around. I'm like, are you going to get on an airplane and fly to Chicago where there's a 20% chance of landing, successfully? I'm like, no, you're going to get on another plane. So the concept and the idea of personalized. Now, when you talk about outliers, let's talk a little bit about that, right? Now, there's outliers can be from an anatomical standpoint, right? Not everybody is born the same way. I could make an argument that everybody's femur is unique to them as far as their anatomy is concerned. So what does it mean by outlier so our listeners understand?
So, an outlier is someone, if you make an implant in a certain number of sizes, there's going to be patient's anatomy that you just can't make that implant work. I mean, everyone's now, which to a lot of our surgeons' credit, we're always trying to push the envelope and use new technology, whether it be robotics or navigation or patient-specific instrumentation and changing alignment techniques. Everyone's trying to improve the results for our patient. But all along, what's been right there is what I consider the holy grail, which is to make the implant specifically for the patient. And then all these workarounds become much easier because you're starting with the patient and then everything else is just there to support you.
I think that's terrific. And the other thing, just again, for our listeners, we were trained, I've been doing this for 30 years. You put them in everybody in the same alignment. It didn't matter if you were short or tall, if your knee went inwards or your knee went outwards. We put everybody in 7 degrees from the hip down through the knee down into the ankle. That's what we were trained to do. Everybody got the same thing. Why are we trying to fit the patient into the same category? Why not leave them where they live? So talk about the identity knee, for example, which is the Restore 3D personalized or customized implant. What's so special about that for you in particular?
Yeah, so it just some things are unusual. When we look at most knee designs, almost all knees that are designed throughout inception have been symmetric implants. Yet I've never seen anyone's knee that is completely symmetric. Everyone knows there's a varus slope to the knee and there's a offset of the distal femur and posterior femur. And then, there's different shapes of the knee, so what's really interesting, the implant companies have responded by increasing the number of sizes, which is fantastic. But what they haven't done is change the shape of the knee, right? So implants may come in numerous sizes, but they all come in one shape. So when you start to personalize implants, now you're not only giving the patient the size that they need, but also the shape that they need. So it becomes much easier to balance because the shape is there. And the shape is what drives the feel and function, particularly on the knee side, but also on the hip side.
No, I think that's fantastic. So my friends Yvonne Tornos and Aldo Dente and Leslie Storms, are you picking up what we're putting down here? This is some really impressive things. And I think the reason the major players have really not come to this type of process was because the technology wasn't there yet from the manufacturing side. And they couldn't sort of grasp the concept of how they could now scale and manufacture this in a way in a timeline that's reasonable, make it affordable so that you can get this surgery done in an ASC, right? Which is where we're going at this point, so that it falls within the parameters of what most commercial and CMS payers are going to pay for. Do you have any commentary on that?
Yeah, those are, I mean, those are obviously great companies, and they've done a lot and taken us a far way. And so, I appreciate all the things they've built, and they, what's the difficulty for them is in some areas, knee in particular, it's hard to envision how you could make it scalable. They are, though, working on that, and Stryker would be an example. They have a patient-specific shoulder, so does Zimmer. So in some of these other areas, they're starting to pick that up. I think in knee, it's been hard because there's cobalt chrome and titanium. So you've got to be able to print both of those. You've got to be able to do the polyethylene. And so that actually, I think, is something the technologies have not been there. And so that's been harder for them. And, then I do think there's a question of how far, how many knees need it? Is some people will say, well, we're not sure if everyone needs it. Well, even if 10% of the people need it, that's still an enormous market that's important. So that's some of what we think about and what I think has made it tough for the larger companies to do in knee, at least.
Absolutely outstanding. Well said. All right, James, we're moving our way down the anatomy. Here we come. We're coming to the foot and ankle at this point. So, let's talk a little bit. Let's just start where it is. I know that when it comes to a knee joint or a hip joint, the other joints are pretty far away, right? So we kind of focus on that single joint, right? But in the foot and ankle, those joints are all close by. So talk to us about what was the reason that you thought personalized implants for the foot and ankle was going to be something attractive for your patients?
No problem. So, number one, Dr. Sigman, thank you for inviting me to be on your show. In the foot and ankle space, the joints are relatively complex, and there's a number of reasons why patients would want something that's specific. So, number one, the trauma that is sustained can be in the younger or older population, but then as we age, there's arthritis. So, in the trauma population, there's a lot of deformity. In the arthritic populations, the joints start to collapse and they become, really stiff. And so what we don't want is, like Dr. Martin said, we don't want one type of implant for everyone. And so as my patients came into my clinic, I always wanted to figure out a way to make everything a little bit more specific, so that way I can restore their motion, but also restore their alignment. And so that's where Restored 3D came in with a lot of their custom implants.
You cut out for a second when you started to say restore their motion. Can you kind of start from there again? I'm sorry, your internet kind of cut out for a second.
That's annoying. I'm sorry. So what I really wanted is for an ability to restore the alignment as well as the motion of my patients, and that's where Restored 3D came in.
All right, terrific. So again, for our listeners, tell us about the operations that are available using personalized implants within the foot and ankle space.
Right. Well, what's amazing is we're really reached the point of where I would call the future of foot and ankle surgery. This is one where we can not only reconstruct or recreate a bone, but we can create soft tissue attachments. So that way the tendons and ligaments have an ability to be attached to the new bone as well. The most common cases that I do involve a custom total talus. That's the bone between the heel and the leg. But there's also the ability to create a total ankle replacement, or even replace other bones that are near the ankle and the back of the foot as well.
Fantastic. So again, I've been doing this for 30 years, and I'm just going to say this out loud. Ankle replacements sucked forever, right? I mean, the results just weren't good. They did not have a lot of capture. Nobody wanted to do them. And you got an ankle fusion, right? If you had, or for significant arthritis, whether it was from trauma or old age, the operation was pretty much to just fuse the ankle, which is not the greatest operation. You want to have range of motion and movement if you can help it. How are you going to play pickleball with an ankle fusion, right? Down in Florida. That's all you guys do down there, I'm sure. But no, seriously. So tell us how there have been improvements in technology when it comes to ankle replacement surgery in particular.
Right. To your point, in the past, an ankle fusion might have been your only option. And in some of these patients, an ankle fusion is not even an option because the bone that you would fuse the other bone to is a dead bone. So you have a dead bone sandwich, which won't fuse. And so now we're at a stage where the dead bone is no longer a concern. We can replace that dead bone with a custom printed bone. As Dr. Gall said, you would use an image of the other side, to create a mirror image of the bone that you want to replace. And so we can customize that and then use that to totally improve a total ankle replacement. It's actually pretty fascinating and quite amazing.
And then you can attach the tendons to it too. You can put like little outcroppings and stuff so you can like suture into it. That's like crazy, man. That's so cool.
Yeah, I mean it sounds like it's futuristic science fiction stuff, but it's happening now. So not only can we create a surface for the tendons and ligaments to attach to, but then you can create custom holes so that way you can put in screws to attach one bone to another if necessary. It's quite fascinating.
And then you can also incorporate the deformity that's in there, right? Because a lot of times they have like collapse of their arch, for example, or maybe there's another joint further down the line that really needs to be affected. So being able to sort of customize that and tweak all of that, same ideas within the knee, keep them within their anatomy if you can, but then just replace the bad parts.
What's interesting is I even had a gunshot trauma patient that had shrapnel in his leg, and I was able to work with the restored engineers to accommodate the fact that the shrapnel couldn't be removed, but he also had a deformity that I had to correct. So the engineers are quite instrumental to this process as well.
Fantastic. Greg, let's pop back up to you for the knee for a minute again, because I really want to hammer home. There's this new concept within joint replacement, right? I talked a little bit about it, the mechanical axis. We used to put everybody in 7 degrees when you were doing your fellowship, probably at the Brigham. That's what you were doing. I was at the New England Baptist Hospital doing that with some great docs as well. And now there's this push and move to things called kinematics. But again, for our listeners, kinematics means instead of pushing everybody to the same alignment, we're going to keep you in your native alignment. So that way we're not shifting and changing your ligaments around too much because you've been that way for 20 years. And so tell me how Restore 3D fits into that change of mechanical axis to more of a kinematics type process.
Well, right now the system is designed around mechanical alignment, but by restoring the anatomy, it's amazing how close you come to normal kinematics. There's been live fluoroscopic studies done which really demonstrate this, how it mimics the normal rollback and kinematics of the knee. So that's what I was alluding to before, is that when you restore the shape of the knee, the distal femoral offset, the posterior condylar offset, as well as the 3 individual J curves, the kinematics kind of fall into place.
Terrific. So again, for our listeners, what they're trying to do here is really try and match your anatomy. We're not going to, you may be 5'8", and then the next person in line may be 6'5", and one may be crooked inwards and the other may be crooked outwards, but we're going to try to match the anatomy to what you're doing along that axis. So Ken, one of the other hottest topics, in orthopedics and joint replacement is robotics, for sure. Now, I think that with Restore 3D and the Identity Knee in particular, you can you take away a lot of the things that the robot does, but I think there's still synergy between what you could do with Restore 3D and a robotic system. If you give it the right data, the robot can do whatever you want it to do.
Yeah, I would completely agree. Actually, I would say the technologies are very compatible. If you look at robotics or navigation or virtual reality or other ways to process all that, and also just the whole idea of personalizing with data, and so I think personalization goes beyond the implant. We do think that, and those are things we're also working to look at. So we think it's very compatible with those. And I would agree, if you want the robot to put in a personalized knee, you give it a personalized plan. So I think it's not an incompatible technology. And I think those are all very important advancements.
Yeah, and it'll be really interesting. I mean, to Greg, I mean, I read your LinkedIn post where you showed the tibia, for example, and you were matching the tibia. And man, I'll tell you, it's like black licorice and the Grateful Dead, right? The people that want to stay with the old school way of thinking all say the same thing. That's close enough. It would have worked out fine. But then there's the key opinion leaders, the people that have courage to have innovation, that look and say, we can do better. How do we get a 20%, dissatisfaction rate closer to 2%, right? So tell us about your thoughts about that.
Well, Scott, I mean, there's been several studies that show that just 3 millimeters of overhang can predict ongoing pain after knee replacement. I myself have revised several people. When you work up painful total knees, sometimes you see these folks, they have implant overhang and you revise them and their pain goes away. And it's interesting, the patients understand this almost more than surgeons. There's so much pushback from surgeons, but everyone is, you talked about your feet, everyone has bought a shoe that's a little bit too small or a little bit too big, and they don't want to wear those shoes, right? And for those shoes, you can give them away to charity or whatever you want to do, or throw them away. But when someone implants something in your body, it's not so simple, right? So the patients understand this. And once they hear that they can have an implant that's made for them, that's gonna fit them, that's all that they want.
I mean, it's logical. It just makes sense. And I think that the problem has been previously, is the ability to manufacture and make this cost effective and be able to scale. And I get a great sense that Restore 3D has got solutions to those issues. So Ken, let's talk about another thing that I think that Restore 3D does, which is really remarkable. And that is, let's go to the extreme outliers, right? These are patients, for example, that have cancer that need a pelvic reconstruction, or a patient that's had 3 failed shoulder replacements, for example, and there's tremendous bone loss. Or for example, in the ankle where there's been a severe traumatic injury. You guys can create truly unique custom implants for those patients that had no other solution previously.
Yes, and that's a very exciting area for us. And, ultimately we're trying to personalize implants to improve patient care, right? It may be obvious, but I'm stating that is our ultimate goal, and to give them better outcomes. There are patients who there are very little clinical options. And in foot and ankle, you get an amputation. Dr. Toussaint knows that that's one of the options that you get. In the knee side, you might get a revision of something that, we're thinking, well, it's maybe going to work. Shoulder, as you well know, you have glenoids that are just so diseased. There's so little bone to attach anything to. You have very few options. And we've been able to create ways to treat those. And that's how we started the business. And I think that's also classically been a tough business for large orthopedic companies to do, because you have to have a seamless, low-cost way to do those to make it a business, make it profitable business, and be able to help the patient and also still sustain. And that is something that's very rewarding for us, and we're continuing to do.
Yeah, no, I love it. And so I'm going to steal Greg's quote here. I mean, I think it's fantastic. And Jordan, I know you're listening here too, but it's got to be a part of your brand, which is, leaving no patient behind. Restore 3D leaves no patient behind. Guys, we're coming to a close here. I'd like each one of you to give us a few closing comments, again, both for orthopedic surgeons and for patients, as to why you think this is going to be the way of the future. Greg, you want to start?
Sure. Yeah, I think, everyone comes in all different shapes and sizes. And we all know that some people that are very heavy set, you open them up and their bones are tiny as could be. So it just makes sense that, number one, 3D planning ahead of time is necessary to really execute on this strategy. Even if you don't believe in customized implants, you have to first start and believe that 3D planning a surgery has to be better than 2D planning. And if you subscribe to that and believe that, then the next step is that why not create the implant for the patient, right? The argument is, yeah, maybe you only need this 10 to 20% of the time, right? That's an argument, but it's about not leaving those patients behind. And then the other problem is, unless you're really doing accurate 3D planning, you don't know until you get in there, and then it's too late, right? So I think the way forward, and what Restore 3D is going to carry this torch is, we're going to be the best in 3D planning, and then deliver a patient implant that's specifically made for the patient.
Well said. James.
My job is to be the surgeon that avoids an amputation. So I want to be the salvage option for all of my patients, and Restore 3D is allowing me to do that.
Fantastic. Ken, what do you got for us?
First thing I want to say is to thank, Dr. Martin, Dr. Toussaint, and that we have a lot of pioneering surgeons that we've worked with, and thank them for believing in us and actually helping us get the implants. And then to the patients we've been able to help, and thank them for, wanting to work with us. And get these implants. And so I think there's a bright future ahead for the patients that are listening. I would say, we can build implants that are designed just for you. There are, lots of great surgeons are willing to put those in and give you the best possible outcome that we can give you. For surgeons that work with us, as I said, thank you. And those that have not worked with us, we're willing to work with you on the most difficult cases first. Give us the ones that are most challenging outliers. We'll take those and show you what we can do, and then hopefully work into the quote unquote less complicated patients. But that's sort of our mantra.
Fantastic. Restore 3D is providing personalized solutions for orthopedic implants to leave no patient behind. What an outstanding job, gentlemen. It's been a pleasure having you on the Ortho Show. This is going to be a great informative episode for our listeners. This is Dr. Scott Sigman, #FollowThePro, host of the Ortho Show. Till next time.